Okay, thank you. So, good evening, everyone, and welcome to this meeting of the London Borough of Newham Health and Adult Social Care Scrutiny Commission. Can everyone present hear me? If you can't, please raise your hand. Thank you. This evening's meeting is being held at Newham Town Hall in East Ham. Members unable to attend in person at this location are able to join remotely. However, they'll not be able to vote and their attendance will not be officially recorded, though their virtual attendance will be noted in the minutes. So I'd like to start by welcoming the members of the public and press who are physically attending or watching on YouTube. With regards to meeting etiquette, members of council, please can I ask that you indicate that you wish to speak either by using the hands up symbol on the Zoom or by using your physical hand. On this point, may I also remind everybody to introduce themselves when speaking for the first time in terms of their name, role and organisation for the benefit of the recording and for those watching the meeting. And also to keep microphones muted when not speaking. This meeting of the London Borough of Newham's Health and Adult Social Care Scrutiny Commission on 29th October 2024 is now called to order. So firstly, my lovely committee to introduce themselves. Starting at the back.
Good evening, Councillor Jane Lofthouse, representing Class South.
And to your right?
Councillor Patricia Wanya from Tanita South.
Councillor Joel Aguda from Plaistow North.
Councillor Danny Keeling, Stratford Olympic Park.
And I'd also like to offer a warm welcome to the Cabinet Portfolio Leads, Council Officers and Partners here this evening who will introduce as the meeting progresses. So first off, the Commission has the task of electing a Deputy Chair for 2024 to 2025, who can act as Chair in my absence or other matters related to the Commission as agreed. I've received one nomination in advance of the meeting and move the nomination of Councillor Liz Cronin as Deputy Chair of the Commission. Do I have a second? Councillor Lofthouse. Are there any other nominations for Deputy Chair? Okay, so can I see the agreement of the Commission for this appointment? You all agree? Fantastic. So Councillor Liz Cronin is elected as Deputy Chair of the Commission. The third item is apologies for absence. I've received apologies from Councillor Lewis Godfrey, Councillor John Gray and Councillor Melanie Anovo. Have there been any other apologies?
No other apologies, Chair.
Okay, so members, apologies for absence from members will be noted. Item 4, declarations of interest. Are there any declarations of interest from members of the committee for any item on the agenda?
No, I just want to put on record that I've got an adult who's got special needs, my granddaughter.
Yeah.
So is that noted?
Yeah, no.
Fantastic. The next item is to agree the minutes of the meeting held on the 3rd of July 2024. Does anyone have any amendments? Okay, and members are also asked to take note of the response to the committee's request for physical activity data broken down by demographic groups, which arose from our last meeting. This will form part of our ongoing assessment of leisure provision in the borough, which we'll be returning to in our final meeting of this scrutiny year in April 2025. So I move that the minutes of the Health and Adult Social Care Committee meeting held on 30th of July 2024 be agreed as a correct record. Do I have a seconder? Councillor Keeling. So it's noted that the minutes are agreed. In terms of the management of the business of the meeting, as Chair and with the committee's permission, I'd like to confirm that the agenda items will be taken in agenda order. So we will have item 6, the Meeting Newham Future Needs Scrutiny Report. Item 7, update on emerging matters. Item 8, adult safeguarding, an update from the Safeguarding Adult Board and also from our local London Borough of Newham team. Item 9, 0 to 19 health services. Item 10, health and adult social care Scrutiny Commission work plan, and then the date of the next meeting. So moving on to item 6, future needs scrutiny report. The Commission's review, meeting Newham's future needs, an analysis of the challenges and plans to address population growth and demand pressures on Newham's health and care system 2020 to 2040, focuses on how the North East London health and care system is responding to a projected 20-year period of borough-wide population growth. Newham is expected to see an increase of 110,000 residents, as well as a large proportionate increase in the cohort aged over 60, resulting in a significant rise in demand for health and care services. The Commission's review of the system's response took place over 5 meetings in 2023 and 2024. And the purpose of this item is to take any comments on the report before it's referred for onward submission to Newham's Umbrella Overview and Scrutiny Committee, and then Cabinet for a final executive response. Just before I sort of invite comments, I'd like to thank system partners present this evening and not present this evening for their valued feedback on the report's findings and recommendations, which hopefully they'll find reflected in the final draft presented in tonight's papers, on page 29. However, we welcome any final remarks. Does anyone have any comments? Can't see any indication on the screen. Can't see any hands. Okay. Councillor Wilson.
Yeah, Councillor Neil Wilson, Cabinet Lead for Health and Adult Social Care. We will have to take this offline at one level, Chair, but just to alert the committee that because of the congested agenda that we were hoping to go to, I think, in December, we may have to move this into the new year for an executive response. Because although not many of the implications, can everybody hear me all right? Sorry, my hearing aids, I'm picking up noises off there. Well, obviously there are fewer recommendations of LBN and other partners. 2. You know, we do have to actually coordinate that before it goes through the process of an executive response on behalf of the Mayor and the Cabinet. So I'm just flagging it up, Chair, that there might be. It's not that we don't like the report. We think it's an excellent piece of work, and we've already had that informal.
Yes.
Yeah, it's just what's the word? Logistics of it. Yeah, that's that one.
Yeah.
Excellent. Thank you very much, Councillor Wilson.
Sorry,
Councillor
Chair, no,
Laguda.
it's not a question, just to let people know that I've only got one hearing aid.
Yeah, we're doing well.
So when you're speaking, can you speak a bit louder, please? Just one hearing aid working.
Noted,
6 months before I could get appointment.
So I move, after Councillor Wilson's comments, that the committee's meeting Newham's future needs scrutiny report be adopted and referred to the Overview and Scrutiny Committee for onward consideration by the Mayor and Cabinet. Do I have a seconder? Councillor Aguda. So that is agreed, and we now move on to item 7, update on emerging matters. So the purpose of this item, for anyone who's not attended this committee before, is to offer an open space for members to raise questions around the impact of national developments upon services in our borough, or to receive updates on ongoing and emerging issues and strategies within our Newham healthcare system. So for this item, I would like to Councillor Neil Wilson, who we've already been introduced to as Cabinet Member for Health and Adult Social Care. Councillor Mumtaz Khan, Deputy Cabinet Member for Health and Adult Social Care. Jason Strelitz, Corporate Director of Adults and Health. Claire Solly, Director of Quality Assurance, Safeguarding and Safeguarding London Borough of Newham. Do we have Charlotte Taylor tonight? Yes, we do. Director of Improvement, Change and Control for London Borough of Newham. Julie Powell from Health Watch, I see you online. Joe Fraser-Wise, I also see you online. Simon Ashton, Chief Officer for Newham Hospital. And then I can see Daniel Wilson and Shola Afuape, who will be joining the discussion on the next item. So welcome everybody. Is there anybody else attending that I failed to introduce? So
Hi, Chair. Yeah, it's Jonathan Cox, for Public Health for the 0 to 19 item later.
fantastic. Welcome, Jonathan.
Hi, Chair. So Damon Brown, Head of Brokerage and Transactions in Adults and Health.
Fantastic. Welcome, Damon. So firstly, in this section of the meeting, I just wanted to put on record a quick update. In this section previously, the Commission asked questions around a transfer of backroom services for 3 local GP practices, the Carpenter's Practice, the E16 Health and Lucas Avenue, from Operos, the UK arm of US private health company Centene, to the HCRG Group. Despite due diligence procedures not having been completed by the relevant ICBs, the transfer of backroom services had taken place across these practices alongside all other AT Medics run practices in England, which are around 60 in total. In our neighbouring ICB, North Central London, covering Camden, Islington and Haringey, I note that all 6 surgery contracts previously held by Operos within the ATC Medic surgeries were cancelled as a consequence of this breach. I had hoped to ask some questions about this tonight, but unfortunately we don't have any representation from primary care with us this evening. So with the permission of the Commission, I would like to write to ask my questions around whether there'll be any penalties applied in North East London, and if not, whether any explanation can be offered for the differences in reaction, and also whether any central conversations were held within the NHS, given the fact that surgeries were affected across the country.
Councillor Novo is John.
Okay. And Councillor Fraser-Wise, sorry, not Councillor,
Yeah.
Joe Fraser-Wise, you'd like to come in. Sorry, Joe.
Yeah, that's fine. Not a councillor as yet. So yeah, I can just give a brief update because this was discussed at the Primary Care Contract Subcommittee, and those papers are also in the public domain, so we can make sure members of the committee have a link. A paper went that basically outlined the risks of different options in terms of what to do, and the subcommittee agreed that because of that, on the balance of risk, there would be no further contractual action against Operos, as you've said. They considered the benefits and the risks of each option, and what they'll do is, as each contract comes up for a review point or renewal or expiry, they will be considered on a case-by-case basis.
Thank you, Joe. So I'll still write my letter asking a couple of those questions, but thanks for filling the Commission in. That's really helpful. The second item I wanted to cover in this section is an update on the consultation carried out by Newham's Adult Social Care Directorate on a decision to remove the cap on care costs. Before we hear from the team, members of the Commission should note that this decision was actually agreed by councillors as part of the adoption of the 2024 to 25 budget proposals at full council back in February this year, after which it was realised this change could not take place without a consultation. So, Councillor Wilson, would you like to come in on this item?
Yes, thank you very much, Chair. And it is rather unfortunate that when we have a budget making process, the implications of the consultation were not necessarily conveyed to officers. So there's been catch-up exercise. This was designed as part of the MTFS savings, 93% of which I would please report to this committee have been delivered. In fact, that percentage I think is increasing.
Yeah.
But this is a residual item that we had to consult. It hasn't yet gone to Cabinet, so I cannot, talk too much on this item till I receive the report. But to alert this committee that, any change will now not take place to the new year. And I think the officers will be talking about the process on how we did try to reach as many people as we can. I think the scale of the issue is to be also highlighted. This will affect, because we're an outlier in keeping this cap on charging. I think there's only 4 left in the London boroughs, and this will affect 35 residents of a cohort of 4,900 people known to have pulled adult social care packages. So we're talking at 0.8%. That is also, though, obviously it's an issue that people are worried, and that's why the consultation that Charlotte and Daniel will explain, was so important because people get worried because, you know, when you remove something with the cost of living crisis and you know, the very real inflation that people have been facing, people will sometimes worry about obviously their own disposable income and what is the implication for their own individual circumstances. But because adult social care is so individualised, it has been quite a difficult process. But I'll hand over to the officers. Let's Chase wants to come in on any of that.
No, well, difficult, yes, but I think we've done a really good job. So I'll hand over to Charlotte and Damon, and then I'll come in if there's anything I want to add afterwards.
Is that right, Claire, at the moment? Yeah.
Yes. So would Charlotte, Charlotte, do you want to come in?
Absolutely. Thank you very much, Councillor Masters, and thank you, Councillor Wilson and Jason as well. So just to kind of to build on what Councillor Wilson said, really removing the cap will bring us in line with the other London boroughs and really supports that position of equity where those residents that have been those 35 residents that Councillor Wilson's described who have been financially assessed as able to pay the full cost of their care are doing so, and therefore the limited budget that we have is able to support more residents. So as you really helpfully introduced, Councillor Masters, we held our consultation across the summer. So the consultation took place between the 15th of July and the 25th of August. This was extended from the kind of recommended 4 weeks to 6 weeks to take into account the fact that the consultation took place over the summer. So we pulled together quite an extensive information pack about the proposals to remove the local cap, which was distributed to 1,625 residents. So those 35 who were identified as being directly impacted by the proposed changes, but also a further 1,590 residents who currently pay a contribution less than the current cap of the £400 a week, but who aren't directly affected. And the reason why we wanted to do that was recognising that people's financial circumstances and their care needs change. So we wanted to make sure that we were being really inclusive and writing to all of those who are currently pay a contribution towards their care. Should be noted that some people pay as little as £2.50 a week, but that really does range, and there's a huge range. And of course, there's a large number of people that are financially assessed who don't contribute at all as well. So we wrote to those 1,625 residents with, like I said, quite an extensive information pack, which provided a summary of the proposals, a hard copy of questionnaires. It also provided a number of kind of signposting and information and advice resources, including debt advice as well, just because we were concerned and we wanted to make sure that we were signposting to those that may need it to a wide range of information. It also advertised a number of opportunities that people could get involved. So we had not only the kind of online and hard copy questionnaires, but we also held a number of face-to-face meetings. We held drop-in sessions as well at various points throughout the borough, as well as online opportunities for people to join perhaps in an evening, particularly recognising the role of family carers that might support people to manage their finance. So and in addition to that, those 35 people who are directly affected were also contacted by phone as well to make sure that they'd seen the information, give them the opportunity to ask any questions, and actually give them the opportunity to complete the questionnaire over the phone as well, if that was preferential for them. So we tried to be as inclusive as possible. And what I should have mentioned is quite early on, we took our proposals for consultation to the Newham Co-Production Forum to get the views of residents, to make sure that we were being as accessible as possible. And they actually suggested a few changes, which we then implemented. So, for example, we went out to a kind of sensory coffee morning held by Enabled Living, which gave people with sensory impairments the opportunity to understand more about our proposals, ask questions and contribute. So we did as much as we could within that period to make sure that we were absolutely contacting those 35 residents, but that we were reaching as many of our kind of wider residents who currently contribute as well. So following the consultation, slightly disappointingly, given all of our efforts, we only received 98 responses. So that equated to about 6% of those who were contacted. And interestingly, the majority of those were actually submitted online. Most of the feedback was, unsurprisingly, that people didn't necessarily agree with the proposals to remove the cap. People felt like it was a bit too much too soon. However, if we kind of look back in time, our proposal, when we were due to have a new lifetime cap on care introduced by the government, we were due to remove the cap on care in 2026 anyway. So it was something which was always on our kind of roadmap, as it were, for this work. So whilst, as we've said, that the wider respondents weren't, it was a limited pool of responses, and the respondents weren't supportive. Largely, people did give us quite a lot of kind of constructive comments, and I think what it showed us, and I guess it's building on Councillor Wilson's earlier point, that it is highly individualised, and not everybody understands how their individual care amount contribution is formed. So we've done quite a lot of work with individuals since, and we've also implemented one of the recommendations which residents gave us, which is to do monthly drop-ins for members of the public, so they can come in and talk to us face to face about their care charge, any concerns they've got, and different mechanisms for paying that. So I think it's been really, really useful for us to understand people's perceptions, understand people's understanding of their care charge, and actually we've done some work therefore, and we're continuing work to develop the suite of materials to support our residents during this time, but also moving forward.
So just so I can understand it, you've completed the consultation.
Yes.
What are the next steps?
So the next, yeah, please do, Councillor Wilson, sorry.
Yeah, I mean, because this is then it gets into the political arena. We've had the consultation. It was offered up as a saving under the MSTFS, whatever it's called. I always get those initials muddled, but you know where I'm going with this. So it has to come back for a cabinet decision. That paper has not yet gone through that process. So I'm reluctant to say any more, but I don't think that's quite how scrutiny should be, because you're not shaping the policy. I mean, there's a really good opportunity for pre-scrutiny work, but this is a residual sort of outlier that we have to now take to a cabinet decision. So I think that's, well, I don't know, Jason, I think that's all I can say at this point.
Yeah, I mean, it's unless cabinet changes its mind, the plan is in the budget for this to go ahead. So a paper will be going to cabinet in December with the decision for cabinet to make around going forward.
Okay, Councillor Keeling, you've got a question.
Thank you very much, Charlotte. My question is, with such a small response, do we take it that those who are silent are satisfied, or do we need to reach out for further support?
I think it's a difficult one to judge, but I think personally my view about this is that most people aren't going to respond to a consultation about something that doesn't affect them, and this is affecting such a small number of people that I wasn't surprised by the small number of responses. I think really, in reality, for this kind of policy decision, the individual work done with the small number of people directly affected is, to me, more important than the kind of wider community consultation, because that's more of a political policy decision. So the individual telephone reaching out to individuals directly affected, I think, is more important. And in some senses, it's not to get their views on whether this is the right thing to do or not, because who's going to think that making them themselves pay more is the right thing to do? It's more to ensure that we've got the right mechanisms of support in place for people who are affected by it. So as well as all of the things that Charlotte mentioned, the other things that we're offering to everyone who is directly affected is support around their care assessment, to think about, are there less expensive, are there different ways in which their care needs can be met, which would have fewer financial implications for them as well. So yeah, that's how I see the consultation around this particular policy.
And I don't want to lose sight of a very important point that Damon and Charlotte, the officers concerned, that we're now running monthly drop-ins. So in a sense, we've got greater contact with people around their individualised packages and what the implications are.
I've got a question. How was it that the service brought through this change without realising that they needed to consult?
That's a question by the officers.
Well, I think our understanding at the time was that the budget process represented the consultation that happened around the budget process meant that it would be included as part of that consultation rather than a specific consultation.
But outside of, I mean, I know you obviously consulted with Budget Working Party in terms of councillors, and the co-production forum would have had the proposals brought before them. And I can't remember whether we did a resident event last year or not.
Yeah.
It was one resident event. Did you feel at the time that that was sufficient?
Well, like I say, I think because I see it as different as, for example, a service design issue where we would absolutely, you know, if we were changing a model of service design, you'd absolutely go through a process of genuine co-production, like or developing a new strategy, or because this is a policy decision about which is fairly binary about the cap on care, and I think the results from the consultation are fairly predictable in that sense. It was a budgetary decision, which is why I understood through the budgetary process that was sufficient in the same way as other budgetary decisions that were recommended through the budget process. Right, I see it as different from a service design issue. If we'd, for example, if there'd been service issues that we'd had NTFSs around and we were going to redesign, for example, approach around community opportunities, for example, which we are, I would absolutely see that as something where you would do deep co-production engagement with around how to do that in the best way. But because this is a more of a binary decision around the financing, that's how I saw it as part of the budgetary process.
Okay,
But just on that, sorry, Susan, I know it's a small item, but it can, because I think, you know, the audiences that, you know, within the political process have to be clear that we are making certain in the next trial, because there's all these pressures, but we all know about in terms of budget, that we'll be very clear on when we do have to go out for consultation. This was, as Jason said, something that we thought was a financial decision, not about redesigning, say, community opportunities or a complete redesign of a service delivery model. But we have been. Something in Charlotte.
I think you've answered my question, so I'm really happy with that. Are there any other questions from the?
We do need to reassure the commission.
So I think with that, does anyone else have any issues they want to bring up in this section of the meeting that they've seen nationally that they've got questions about while we've got a full spread of partners in the room, or are you happy to move on? Okay, in that case, I'm going to thank everyone who attended this item and move us on to item 8, which is adult safeguarding. So the purpose of this item is to provide an update on the work of Newham's Safeguarding Adults Board in anticipation of the publication of its annual report later in the year and within the context of wider system safeguarding arrangements. This follows on from a scrutiny session held in January of this year. It is intended to update the Commission on current challenges, but equally any progress in the way safeguarding services offer across the borough's health and care system. It's also an opportunity within this wider system to check the robustness of our own local London Borough of Newham Safeguarding Adult Service at a time of acute budgetary pressure. So we've received a presentation from the independent chair of the Newham Safeguarding Adults Board, outlining the board's achievements, progress and future priorities, as well as a presentation by the London Borough of Newham's own adult safeguarding team. To support this evening's discussions, as a reminder of what's been previously discussed, but equally an introduction to safeguarding for newer members of the committee, members were also provided with, purely for illustration purposes, a copy of Newham's Safeguarding Adults Board Annual Report 2022 to 23, just an example of the board's historic approach to this report. Minutes from the update on the Newham Safeguarding Adults Board received in January. Answers to questions raised by the Commission at the January 18th scrutiny session. And finally, a link to a recent Safeguarding Adult review published on the Council website, just to demonstrate the complexity of cases that meet the bar for such a review. So in terms of this item, I'd like to welcome on Zoom from the Safeguarding Adults Board, Independent Chair, Shola Afawepe, and she's joined tonight by Daniel Wilson, the NHS North East London Designated Nurse for Safeguarding Adults on behalf of the NHS. Welcome, Daniel. And we should have somebody on for the Metropolitan Police, but I can't see anyone on the screen at the moment. Do we have anyone?
Yeah, good evening, Charles. Good evening, Charles Clare for the Metropolitan Police. I'm the Detective Superintendent in charge of public protection.
Fantastic, Charles. Welcome.
Thank you.
In terms of our own safeguarding services, I'd also like to invite our Cabinet Lead for Health and Adult Social Care, Councillor Wilson, and Claire Solly, Director of Quality Assurance Safeguarding, and Jason Strelitz as Director of Public Health. Are there any other partners still attending who'd like to contribute to this part of the meeting? So in that case, I'd like to ask Councillor Wilson for some opening remarks, and then I'll move on to the independent chair of the Safeguarding Adult Board.
Yeah, thanks, Chair. And I think it's really important that, you know, this item, and from the outset since Shola's appointment, we've had the discussion that Scrutiny has got an important role to play in this. The Safeguarding Adults Board is attended by Jason and I. Claire is there as the lead officer. Shola is it's the independence of the chair is very crucial to this debate. So I don't want to, because we'll come in at the end of after about, you know, how our input is, if that's okay, how we see the input of the Adult Social Care Director in this. But it's important, I think, to start off with the independence in a very crucial way that is consulted upon by the partners. And I'm really pleased if I can just acknowledge the very crucial role of the police in this matter. People like Daniel from the Health Service and all the subgroups that Shola is carefully navigating through. So it's a really, I think, impressive work programme. I think Claire and Jason would agree. But it's very important that this is individuals that we've got a wellbeing power as a local authority, and that wellbeing power extends to all of our residents in all circumstances, and safeguarding is the most, I mean, the assessment of risk, I think, Jason, you've said in social work practice is one of the most crucial things that social workers on the front line have to assess, but safeguarding is even more another level, Chair. So I just wanted to make that clear that that's the context, the lens. I think we all have to see that, whether we're on Scrutiny or in my role or Montez's role.
Thank you. So handing over to Shola, we had hoped to consider the annual Safeguarding Adults report, the new one today, but I understand it's been delayed. Can you tell us a bit about the delays and what the report's likely to tell us when it lands?
Okay, so thank you very much, Councillor Masters, and to colleagues in East Ham. So first and foremost, to introduce myself, I am Shola FYP, so thank you very much, Councillor Wilson, for your introduction. Just a bit about my background, does it describe my approach to chairing the board? And I'll just set out a little bit more about what the board does, and then I'll go directly to your question. So my background is that I am not a social worker by background. My expertise sits within governance, health inequalities and EDI, and system partnership working. The role of the SARB, every local authority has responsibility under the Care Act to have a Safeguarding Adults Board, and the role has, I guess, three principal requirements, and that is to publish an annual report, which you're making reference to, publish a strategic plan, and conduct Safeguarding Adults reviews. There were a number of key lines of inquiries that I was asked to respond to, and my understanding is that you're going to tease those out with specific questions to me as the chair. So if I go to the first question, in relation to the annual report, there is a requirement for an annual report to be published every year. Last year, we published it in January of last year as well. And the intention is that we are going to be publishing in collaboration with the Children's Partnership in January 2025. In an ideal world, we would have liked to have been able to publish more recent to that, but we have had a number of changes within the Safeguarding Adults team. I started in September of last year, and since that time I've had 3 business partners. But what I am pleased to say is that we've got a new established team, and we've got some additional resource into that team, and able to sort of support us in terms of our capacity, because we have a significant workload. I think Councillor Wilson alluded to that, and certainly in relation to our Safeguarding Adults reviews, I would attest that as compared to my peers, we have a larger number of Safeguarding Adults reviews that we are currently navigating. So that's in part part of the reason why the annual review is the annual report is delayed. We have largely completed some aspects of the annual report, and it will make reference to a number of critical areas that a number of our colleagues have been working on in the past year. Some of that year will be prior to my time as a board chair. I started September, and it's from March 2022 to March 2023 is the period that it covers. Some of the areas of practice that we have, it will report on, will be in relation to how we're working collectively as partners. And I'm very fortunate I've inherited a very strong partnership across the different statutory areas. And one of the areas that I think we do need to sort of work more effectively on, and I see that Julie Powell, that you are here, is something around the resident's voice. And I'm mindful that we will make reference to the fact that that's an area that we need to strengthen moving forward. We have focused some work specifically on disparities experienced by our local population, and there's been a quality improvement piece of work looking at safeguarding concerns and the disproportionate impact or disproportionate number of people from Black and brown communities that are not represented within those safeguarding concerns, as we would expect, as compared to local population. So that's been a piece of work that's been undertaken with support by the public health team, local authority, with Health Watch and other partners. And that's a critical body of work, because that will be underpinning our focus on trying to understand the lived experiences of our very diverse population in relation to safeguarding, our safeguarding arrangements. We have undertaken, and we're still in the process of completing this, an end-to-end review of the safeguarding arrangements, so that we can be assured of the robustness of those safeguarding arrangements. We are focusing work on how we might strengthen our escalation process, and I think Claire will speak on some of this a bit later. The report will meet our statutory responsibility to describe the safeguarding adult case reviews that we have considered and that are published. And I believe that you've had reference to one of those, which is the Lillian Saar. And again, that's been quite a critical safeguarding adults review in terms of the learning for us as a partnership, particularly in the context of trying to understand how much attention we have paid to the cultural context in which our residents are experiencing their safeguarding concerns. There are quite a few other areas. Did you want me to go through all of them, Councillor Masters, or pick them up in the other areas? Questions that you're going to...
I think, I mean, what we tend to do is take quite succinct opening remarks and then go to questions which hopefully will cover the other points that you hope to make. So if you'll allow me, I'd really like to sort of bring the committee in at this point. And Councillor Keeling, you had a question you wanted to put to Charles Clare.
I did, yeah. A year ago, when the Met enacted Right Care, Right Person as strategy involving the triage of calls relating to residents and poor mental health, and the decision that in cases where there was no immediate threat to life or a crime being committed, residents should be rerouted to more appropriate services. Early signs would be good, but how are you managing risk in cases that don't meet your threshold to attend?
We've actually found that the impact of Right Care, Right Person has been pretty minimal across the other services. It's something we have a monthly panel on. We have a detective chief inspector who works with the other agencies so that there's an ability to immediately raise any concerns. And the concerns, and my partners can correct me if they want on who are present, but the concerns are generally few and far between. In fact, I was at a meeting the other day where it was mentioned that perhaps the police have actually gone back to how things used to be in lots of ways, and it might need to be relooked at. One of the difficulties for us has been we haven't got telling statistics per borough as to what the impact of right person has been, and the statistics we have been afforded have been BCU wise, that's the 12 borough command units, or Met wide, which doesn't allow us to focus in on Newham as ideally we would, but that's something that's being worked on as well, I understand, at the moment. I hope that answers the question generally.
Do you want to come back?
No, that's good, thank you.
I'd also like to ask a question to Daniel Wilson. I'm just wondering what the main risks you're seeing across the NHS are at the moment in terms of safeguarding and who they apply to.
Thank you, Chair. With regards to, is this regards to right care, right place, or generally?
No, with regard to adult safeguarding.
So one of the big areas that we're seeing concerns around is in relation to self-neglect. That is becoming an increasing area of concern across not just Newham but all of the boroughs that NHS North East London covers. One of the pieces of work that's happening at the moment to try and support this is the priority subgroup, which is part of the SAB, which is looking at self-neglect. Part of this work is in process at the moment, which is a multi-agency group chaired by a member of staff from Elft and London Borough of Newham, looking at multi-agency policy to actually support staff in recognising the various types of self-neglect and actually having an appropriate response and support package for individuals, taking into account that it's very much seen as an individual case-by-case concern rather than just an overarching response that's needed for groups of people. So that's a piece of work that's ongoing and active at the moment. But that is probably one of the biggest concerns we have at the moment.
Okay, Shola, you've in your presentation you had a really lovely long list of people who attend the Safeguarding Adult Board. The only statutory partners specified in the Care Act are the police, the NHS, and the local authority. In terms of all the other partners you list, how many sort of attend regularly, and do you feel there are any gaps at the moment?
I have to say I was very fortunate that I inherited a really a well-engaged and group of partners. It's very fulsome. I think that I think often a large number of them attend. What I would say is that we recognise that there are a couple who we have reached out to, for example, probation, the London Ambulance Service. We recognise the London Ambulance Service, for example, they have a responsibility to Safeguarding Adults Board across London. I know they have a capacity issue, so we're trying to negotiate how they might be involved in very specific areas of work where their expertise is required. I would also say, in addition to that long list, we also, not perhaps unlike other Safeguarding Adults Board, we have the public health team who are also part of that long list. I would also say that what I think is particularly missing from our partnership, and we are working on that, and I think I mentioned that in my opening statement, are the voices of our residents and our residents' representative. I know we have Health Watch who do attend, but we do recognise that in the proportion of residents and residents' voice and partners, there is more that I think we could do in order to strengthen that. So that's something that we are focusing on, and will probably be something that will come out of the work that we do through our Safeguarding Adults Week in November.
Okay. Jane, you had a couple of questions. I know Shola referenced work that had been done around addressing the disproportionality of global communities, but maybe you could ask about the impact, and then you had a second question around widening the understanding of safeguarding.
Yes, I would like to take them both together. It makes sense, yes. So as the chair said, you have referred already to the disproportionality and underreporting of safeguarding. So in the global majority communities, so where have you got you're working on it, but have you made any actual progress on it? How far have you got?
We're making some progress. I mean, I think it's one of those positions whereby in identifying that as an issue, we recognise that there are important components to obtaining the intelligence that gives us the insight that we need. And there's been an important piece of work working with the public health team. I think Jonathan Cox is on the line here with us as well. And we've been doing some work trying to really tease out the data and the information so that we have the intelligence to better understand what that disproportionality is. We've also started some work looking at the end-to-end safeguarding pathway, so we can begin to start to understand where do we need to get where do we need to try to identify some of that additional insight. So there is some work that needs to be, that we are currently doing, that helps to set out the context and the information that we then need to then are able to analyse and discuss as a Safeguarding Adults board. But that will probably be the next stage of our discussion. We've started some of the discussions at the board. There's some additional work that we need to do in order to progress those discussions.
Yeah,
Can
I say something on that?
Can I just jump in and ask a question, and then I'll bring you in, Jason? And that's just, how will you measure the impact that you're having in terms of disproportionality? Would it be in terms of safeguarding issues that have been raised, or will you have another measure to show that you're having an impact?
I think the measure in relation to safeguarding matters that are being raised is one measure. And I imagine that Jason wants to jump in, because there's probably other measures that we are going to begin to explore as well, but we haven't come to that conclusion as yet.
Jason, sorry.
So I was just going to make the point that the role of the chair of the board is to make sure that we're focused on collective strategic issues as a partnership, but actually it's a responsibility of all of us as the partners to be focusing on our own practice in this area. So whether it's us as a local authority, or the different parts of the health service, or the police, or fire service, or whoever, that equity and inclusion issues are embedded in the way we work. We've had issues come up through the issues as well come up through safeguarding adult reviews. We're doing our own work within adult social care in Newham around what we call person not process, which is really working with our service to make sure that people are being seen in their totality as individuals, so that these kinds of issues are being much more routinely picked up and understood in the way that we support our community. And that, so I think it's important to recognise the role of the board, but also the critical role that each of us as partners have in terms of the responsibility of delivering our services.
Julie, I see you've got your hand up from Health Watch.
Yeah, thank you, Chair, and thank you, Shola, for your report and presentation. So I think the thing that's been really important around the work that the Newham Safeguarding Adults Board is also doing is trying to establish a bit of coherency about the way that we work at a multi-agency level. I think that's really, really important. And I think the work that we at Health Watch have been quite instrumental in doing is raising some questions about the equity of the referral pathways and challenge and raising questions about how does that align with the demographic profile of the local population. But I think you also, picking up your original point, Councillor Masters, about the fact that the board is very much built around the statutory governance around safeguarding, but the piece around the resident voice and the resident experience is also about how do we work together as a system, because actually many of our communities from those global majority populations will not necessarily be known to the state because they don't necessarily have care and support needs. And actually, how do we create a system where we can pick up some of those reported concerns and ensure that people are able to self-manage themselves or look after themselves, or we have support systems in place to be able to raise concerns. And I think there is, you know, I think that's part of the work that Shola has taken over since her arrival in Newham. I hope that makes sense to everyone.
Yeah,
And I think that ties into the second question that Jane was going to ask around understanding of safeguarding.
Which yes, it's been touched on quite a bit, especially from you, Jason. But Claire's report refers to many residents not understanding what safeguarding is. So that could well be a part of the underreporting. So I wonder if you might expand on what could be done there.
Is that a question for me? I couldn't quite hear who it was directed
I don't like to answer. It could be Claire, it could be Jason, it could be you. Sorry, Claire. I was quoting from your report where you're referring to many residents not understanding what safeguarding is, and that it seems to me could be part of the underreporting of it. So.
Yeah, thank you. So yeah, I was going to bring that in when I moved on to my section, but what we've done in adult social care is we set up some workshops with residents to understand their experiences of safeguarding. So did they know what the word safeguarding means? Because actually it means lots of different things to lots of different people. And what were their experiences if they had been somebody who'd experienced abuse, neglect or significant self-neglect. And the feedback that we got was that they actually weren't understanding what safeguarding is. And when they were worried about something, they weren't clear about what action to take. And then if they did take action, they were concerned about what would happen thereafter. So that thing about control and having rights and making decisions and us understanding the individual. So those were really key bits that came out of a number of resident workshops that we did.
But how are you addressing that then?
How we're addressing that is we have, and Shawla's mentioned it in the presentation, we are embarking on what we're describing as an end-to-end safeguarding review. And that will be fully embedding and strengthening our approach to what we call making safeguarding personal. And all that means is making sure that the adult's at the absolute centre of everything. So that will be, examples of that will be making sure people understand what safeguarding is, they understand how to refer, that every time a referral comes in about somebody, contact is made at a time that's convenient for them, in a way that's convenient for them. Because if you phone me out the blue, I might think, who's this? I don't want to talk to you. So building all of this into our practice, nothing about me without me, making sure people are present at meetings and facilitating different ways to have those conversations are all parts of our practice that we're continuing to develop. And all of this leads to better outcomes for residents because they should be driving forward everything that's happening. And you'll see from the statistics in my slides that that is the position in Newham, but there's always room for improvement.
Can I just bring Shola in? Because Shola, I'm not sure if you're having problems with your mechanical hand, but I can see a hand very forcefully being held up.
Yeah, sorry, I didn't mean to be forceful. I just wanted to emphasise some really critical points. I think, and it goes to Councillor Wilson's point about me being independent. I think this is a really important critical question. What sits underneath the Care 2014 Act is the real responsibility we have to empower our local residents. And I think it is in a couple of parts. And I think Claire has referenced it. Yes, I agree that some parts of our community may not understand what safeguarding is, but we also have to understand that our systems and services, by their very nature, have built within them systemic barriers. So it's important to align those two things together. And that's the bit of work that Julie Powell alluded to, and that the board and I've alluded to, that as a board, we are trying to understand that as a system and understand that strategically, that there are two components to it. The lack of understanding potentially of residents, but also we know that our systems inherently have barriers. And how do we address those? One component of that is about empowering local people. Empowering local people is about awareness. So we've got the Safeguarding Adults Week. It's also about awareness with our practitioners. You know, we have to sort of enable our practitioners to understand how they may contribute to some of those barriers and what role can they play to dismantle those barriers so that people can understand what their rights are and people can execute them. We also need to look at things more broadly in terms of things like access, outcomes and experience. So these are all the things that we are trying to begin to have conversations about at the board in order to really get underneath what do we need, what needs to be a seminal shift if we're going to have our local populations really being able to you know, to really have a different experience. So these are some of the things that we're beginning to have conversations about in relation to this topic.
Councillor Keeling, did you want to come in on this point, or?
Yes, please. It was on contacting people at the right time, and as Daniel mentioned earlier, the NHS's issues with self-neglect, and I'm wondering if we're finding it easy to make these initial communications with people with self-neglect, and if it's like as part of their own self-neglect that they're not even answering the phone to us to get that help.
So it's self-neglect is very, very complex, as Quincy will appreciate. And it's particularly difficult at times to make contact with people. Thereafter, it's difficult for them to, in a lot of instances, invite people into the property to have a conversation by the very nature of challenges and forwarding. They can be embarrassed, they don't trust people, etc. So we have to be very creative about who is the right person to have that conversation. So it might be a family member, it might be a district nurse. So who is it that's getting access and has trust? Quite often it's the London Fire Brigade, our favourites, and they will get in. So we're being really, really creative about how we make connections with people. And this is one of the key focuses of the SABS subgroup around self-neglect. So at the moment, we've got a single agency self-neglect and hoarding policy that's led by Adult Social Care. That's very well embedded, but we need to do more and we need to build on that. We're drafting, and it's been led by the SAB, a multi-agency self-neglect policy so that everybody's clear about their responsibilities, everybody's clear about a consistent approach so that we have the best chance to make contact and do what's right for the resident at their pace in a way that works for them. And that's a shared responsibility across partners, communities and organisations in the borough. But it is really tricky. Yeah.
So I want to bring Jane back in briefly, and then Councillor Laguda's got some questions.
Only briefly. And in fact, what you've just said there, Claire, is linking up with what Jason was saying just now, because I just wondered whether Jason was saying you were working with other agencies, other partners and so on. Would that be another way of informing people of what safeguarding is and finding other opportunities?
Absolutely, absolutely. And I totally agree with what Judy said about people who have, don't have strong connections with the state, but most people have at some point who come into contact with someone. And that's the benefit of that multi-agency approach. It may be that they go to A&E in crisis. It may be they do go to their GP. It may be, but it may also be that they're part of active in a faith community. And that's when we talk about safeguarding being everyone's business.
Yes,
there's that collective role in reaching people who are vulnerable, so that services can reach in and find the best way to support them.
Thank you.
Fantastic. Councillor Laguda, you've got a question about the transition from childhood to adult services?
Yes, I was just going to ask something pertaining to this. You know, like they say, safeguarding is everybody's business. We have a client, one of our constituent members. I've been noticing that his feet were terrible. They were black and everything else. So what I did was, I now referred him to one of my nail shop for him to have his pedicure done. And he had, they made appointment and he went and did it. So what I'm saying is, before we go around, we have to be checking as well. Our constituent members, are they okay? Talking of self-neglect. And this is somebody who does a lot in the community. So I thought to myself, you do a lot in the community. Let's help you. So we did, me and Jane managed to get him to go and get his feet done. And if you see the feet now, he's so happy and it has boosted his morale. So it's everybody's business, safeguarding. So we have to be watching the way we treat our constituent members as well. I thought I'll just bring.
That's a really great story, Councillor Aguda. I think we all know well the phrase, it takes a village to raise a child, but it also takes a village to look after vulnerable adults.
Because this is all Plaistow, isn't it?
Exactly.
Councillor Wilson, very quickly, before we go on to.
I think that's an important segue. Claire and I have already discussed, and you've been on, I think, Councillor Peterson was also on, as part of the LJ peer review about member induction, and I was quite clear that it should be member development, because whether we've been on the council as long as some of us are, legislation changes, we've got a new central government, there might be legislative changes, but safeguarding is everybody's concern. And the parallel is that we're going to do some more training on that, because I think they're absolutely right, Councillor Aguda. We have a role as elected members also, as well as trying to develop, whether it's the voluntary community, faith sector networks, anybody within the concerns of friendship groups or whatever, because so often, because of the structural and systematic barriers within what's perceived or reality more likely of health services or professionals or councils, there's also a lack of understanding. So I think we need to train ourselves up, whether it's on the executive or frontline councillors, to make certain that we're clear on safeguarding.
So Auntie Joy, you had a question about the preparing for adulthood board, which I think we were told was.
I don't know who's going to answer this, but in terms of the risks around the transition from childhood to adult services, in January, we were told the preparing for adulthood board was planned to address this. Has that happened? If not, how are we addressing the risk?
But that is for Shona, right? And for Laura's.
How are we addressing the risks?
So Jason and I.
Transition from childhood to adult.
Yeah, I'm Laura Eden, I'm the Corporate Director of Children and Young People. So oversee children up until the age of 18 or 25 when their care leavers will have special educational needs and disabilities. So Jason and I are chairing now a progression to adulthood board. We have a intensive action plan that's being overseen. I think it is fair to say there are capacity issues in terms of the increased demands that we have in relation to children with special educational needs and disabilities, and those who therefore need transitioning to adults, to adult services, and need a Care Act assessment. So we've just had our special educational needs and disability Ofsted and CQC inspection, which did found about 50% of our young people transition smoothly to adult social care. That will tell you 50% aren't. And at the moment, the contingency planning is that children's services are still providing support and intervention and wraparound services to children, but they're no longer children because they're over 18. So Jason and I are working closely with colleagues in transformation across both services and all our operational leads to resolve that issue. It's a capacity issue.
I guess.
How are you monitoring the effectiveness of it?
How are we monitoring the effectiveness?
Yeah.
Well, we're at
transition.
Yes, we're at 50%, which is probably better than where we were. We've created a data dashboard. We've asked the operational leads to put in place pathways and referral. We are tracking each young person, so we know which young person is still in children's and hasn't yet transitioned to adults, and how we are wrapping around them. But it isn't satisfactory. We need to be progressing these young people to adulthood services from, well, anywhere from 14, but most boroughs are doing it from 17 because it's a national issue in terms of the increase in demand and capacity. I just pass over to Jason.
I think just one thing that I'd add on top of what Laura's saying is that's not exclusively around safeguarding issues. So it's also about care, and a lot of that is about care and support. So how, that big transition from children to adult and the nature of support how that changes across that threshold from childhood into, well, still childhood in all of our meanings, in lots of senses, but in legal sense into young adulthood. So there are issues of safeguarding and transitional safeguarding for particularly vulnerable children and young people, but also a lot of the issues that Laura's talking about is how we're meeting young people's care and support needs.
Right, I've got one more general question. Then I want to go over to the local authority for a couple of questions, and then I know Shola wanted to pose a question to the Commission, so that's how I'm planning to sort of end this section. And Joy's next question really sort of brings together something which you were just touching on there in terms of the limited resources that we're having to work with as a system. So Joy, over to you in terms of how you protect vulnerable people in a time of austerity.
Yeah, no, I was just wondering whether we are going to the care homes to find out how the older people are being safeguarded from abuse or anything, because I remember during my time, we were visiting every care home to make sure we find out what's going on. And I'm just wondering whether that work is going on at all.
Very much. I'll let Claire talk about that.
Thank you, Jason. Thank you for the question. So people that reside in our care homes are absolutely part of our community still. And there's lots of work. In fact, I was at a meeting today where they were talking about how people who reside in our care homes can come and enjoy all the wonderful things that are on offer across Newham and the communities. And that's super, super important. So we have a quality assurance team that sits within the local authority. We connect with our health colleagues, community health, mental health, to make sure that they have access to all the things that they need. Our quality assurance team have a schedule of visits that they make throughout the year to care homes, to extra care, to supported living, to speak to residents and understand their experiences, what's working well, what they think should improve. And they've got tools that they use to assess that. And we work really closely with the Care Quality Commission as well. We've really developed our response in Newham. So we've got a very, very proactive approach now to the quality of care and support delivered in the environment in our care homes. So we're not waiting for things to happen. We're in there really early, having conversations, hearing, smelling, being, having contact with people to make sure that our populations that live in care homes absolutely excellent qualities of life and are doing all the things that we enjoy doing. So it's a really strong approach we have across adult social care, but really connected to all our partners in the call as well.
I just wanted to, because that question didn't quite go the way I was expecting it to go. Just really quickly before I come over to the local authority. All of our organisations are working together to address safeguarding risk, but you're doing it with resources that are really under threat. Yeah. Nobody has a lot of money at the moment. So how are you all ensuring that vulnerable residents are not the victims of austerity? And that I'm happy to sort of ask to anyone who wants to come in.
Well, shall I start from the politics of it? Because, I think there is a political dimension to this, Chair, and the committee won't be surprised that I'm taking, in a sense, that the heat of that question, that we need to actually make certain we're not just having the, response for the CQC, which is obviously we're going to be inspecting, but to also highlight that, it's not just people in residential cares, but different settings like extra care and supported living. Wherever our residents are, we have a duty, and it is important that, when we go through difficult budget processes, we've had this conversation offline, but also in budget working party, haven't we? But, there is not just the equality impact assessments, it's a really important way of analysing the effect on our residents, but also to make certain that in discussions with the ICB, which is a fund holder for the NHS, and about people, being discharged from hospital, and there's some really good work about discharge, but still a long way to go, that we make certain that journey is not having a detrimental effect, because safeguarding is seen as over there. It's all of our business. We're back to the village, you know, it takes a village to do the job. Safeguarding is everybody's business. And I think that's an important role for both the budget process to be scrutinising us on, but also our partners, because the whole idea of the SARB, isn't it, is we're all trying to keep, as Jason said, each other to account on this. And with a period of austerity that we've seen, I think the danger is that we could, if we're not careful, without those scheduler visits, without a quality assurance mechanism, that I can assure you, we had a report to my portfolio meeting on this Monday. It wasn't because it's coming up here. That's a regular reporting thing into me and Mumtaz and the mayor. So we've got a checks and balances from the local authority, but we need to make certain the NHS also, or police or whoever, because it's all of our responsibilities. And it is a really crucial question. I'm glad it's been raised, because, you know, that's what this committee, but also us in local authority elected positions, we're here to ask the difficult questions about resources, meaning there's a detrimental effect. Sorry, long answer, but, you know, I think that's
noted. I'm going to have to bring in Councillor Anova, who's sort of joined online. He's got a hand up. I'm just very aware that we're getting quite tight on time, and I've still got the questions that I need to ask the local authority as well. So, Councillor Anova, what would you like to ask?
Hi, sorry, I'll make this quick. I'm just trying to understand. So, you know, it's been mentioned that there needs to be an improvement in kind of resident voices in our safeguarding initiative. We then also know that there's been an increase in demand of services, but then we also know that there are limitations on the budget. And I don't see how those things square away in terms of being solved without some additional spending, given the complex nature of the stakeholders that we see here in need of care. So I just wondered if there was some sort of strategy. If you are saying you want an increase in resident voices with regard to safeguarding, is there could there be more clarity on the strategy and I guess the feasibility of that being achieved within the remit of the budget? I guess that's my question.
Is that one to Shola, just as independent chair of the board? Because you set the safeguarding strategy, don't you?
Yeah, no, I think that's a really important question in terms of how we're going to resource not only a comprehensive engagement, but also the complexity of it. If we're saying that our community are vulnerable and those from the global majority are particularly slightly at a distance from some of our services, and I think you've raised a very important point. It does go in part to some of what Jason said previously, that it's not just one organisation's responsibility to do. Each public sector organisation has a public sector responsibility to engage with its local population and to be having those conversations anyway. It's the degree to which we can leverage some of those existing communication mechanisms to pull the resources together. And the reason why I'm keen to do that as a SARB is there's always a danger that when you make short-term investment in a strategic approach, that is never sustained. But if you can look at how the system can leverage what it already has more effectively and collectively and collaboratively, there's a greater degree of possibility that it can be sustained. So our starting point in terms of the strategy has got to be about bringing the very recipients, you know, of what we're trying to do together to tell us how, how best we can engage with them. What are their challenges? What are their opportunities? Not always take a deficit model approach, because there are many people within our local community, even those that are vulnerable, that have enormous assets to contribute. We just need to facilitate them to do that. So the Safeguarding Adults Suite is our first really important mechanism by which we want to start an open conversation in order to start developing and meaningfully co-create a strategy, as you described, that's going to help us think through and navigate. How do we engage? How do we bring those voices in? How do we make them meaningful? How do we bring some parity to their voices in and amongst established partners? So those are the things that we are thinking about. Does that help to answer your question?
It does. Claire, I know you wanted to come in. I'm going to amass all my local authority questions into one great lump. I'm very aware that Laura Eden is here for the next item on the agenda, so I don't want to keep her too late. And I'm also aware that we're getting near to the end of the time I've allotted to this item. I think, firstly, I'd like to thank you for the presentation that we received. And it's great to see that in terms of the safeguarding inquiries we are getting, that most of those are appropriate and we're better in that than some of our competing boroughs. It's great to know that we always speak to residents at the end of the process and find out whether they're happy or not. But I guess I've got a couple of questions about the experience. One is whether they're consulted throughout the process on what we're doing. And the second one is the ownership of that case. So when somebody gets in touch, as you go through the papers, you can see sometimes they're referred on to other services. Sometimes there are delays in the process. Maybe it takes a while for a court case to get going. Does anyone take ownership of that inquiry and ensure that that resident feels supported throughout?
I'll keep my answers really short. Absolutely. Within the safeguarding adult procedures, there are two critical roles. So one is what we call safeguarding adult manager. So they're a senior member of staff who's had specialist training to lead on governance, scrutiny, and chairing of safeguarding meetings, which should always involve the resident, unless there's a really good reason that that shouldn't be the case. And they are always local authority adult social care members of staff. The second role is what we call an inquiry officer. And again, they've had specialist training to work in accordance with all the things they need to work in accordance with. And they lead the inquiry. We can delegate our inquiry function to other organisations, and we will often do that. But we will retain the role of inquiry officer within the local authority, scrutiny and governance. So they are the key people that keep everything on track.
There was a named person that our resident, and the other thing's kind of related. It's you're talking about this 25-day window. So I'm just wondering what that looks like to the resident, because we know that in other areas that obviously have nothing to do with the areas that come to this committee, there have been issues with IT, and there's a reference in the papers to a two-stage IT process. So we know in other areas that, residents raise a complaint and, they get a case closed acknowledgement when actually all that's happening is it's being moved on to another service. So you get really frustrated residents because they feel they're being told their case has been dealt with when it hasn't, and then finally it gets dealt with. So what I'm trying to understand is, in terms of the 25-day window and you accessing something, what does that initial access look like?
So in summary, there are different stages that a safeguarding section 42 inquiry would undertake. So very, very high level. So the referral coming into our safeguarding adults and independent living team is the first stage of that. So that's a conversation with the resident about what has happened and what they want to happen. And they have, like we all do in this room, rights to make decisions. And there's caveats to that around people's levels of understanding and coercion control. But that first stage is a conversation with the adult about what they want to happen and an interim risk management plan.
So is that within a 25-day window, or is that?
That's within one working day.
Okay.
So every referral that comes in is looked at and a decision's made about what needs to happen. And that can be quite urgent action, or it can be, there's a risk assessment as to what happens. The second stage is what we call a safeguarding planning meeting. And that's to decide the components of the safeguarding section 42 inquiry. So what actions need to be taken, firstly, to make sure the adult's safe. We are working close in partnership with the adult and led by the adult about what outcomes they want to achieve, what are the things they want to happen. The secondary part of that is the analysis about, did this happen and what are the things that our systems might need to change. So we've moved away from, in safeguarding adults, things being substantiated or partially substantiated, towards the data in slide 6 around outcomes for the adults being fully met or partially met. So that's the second stage. The third stage is that work happening. And then the final stage is a closure meeting to say, this is what we've established. Are you happy with what's happened? Are you happy with the outcome? And where needed, there's another stage which would be to review that. And so those are the stages that we go.
And that's all within the 25-day window, or? Okay.
See how it often tips out of that, because it's a huge amount of work and it needs to be done at the adult stage.
Councillor Keeling.
Very quick. I know it's very easy to pick up mistakes in places, but I really wanted to commend the work that is being done. Especially in this report, it even says percentage of Section 42 inquiries where an adult without mental capacity was supported by an advocate. And as a borough, we're at 99%, whereas the region is at 86%. And I just think that's great. It's very good work. Thank you on behalf of the borough.
So I'm going to end this item on a creative note. When I was sort of talking to Shola before this session about what I was sort of hoping to cover, she came up with the idea of posing a question to the Commission. So Shola, the floor is yours. What's the question you'd like to pose back at us, having sort of been grilled by us for the last 40 minutes?
Well, if I should have thought about it now post this grilling, but no, I guess my question was, and it's first of all, I do thank you very much for inviting me. It's been very insightful for me. This is my first SARB chair role, and I recognise still a lot for me to learn about the role and also about the local population. So I'm always looking for how I can leverage the assets within Newham, and I consider the councillors to be assets. So I suppose my question has slightly changed, really. I've got a clear sense from the questions you asked, the degree to which you are very representative of the localised issues within your different boroughs. And I guess my question would be, how might I as a SARB chair benefit from that local insight that you have of the local population? So that's my question back to you as a membership and a commission.
Well, shall I take that offline and we can sort of broker how we can do that? I mean, we've already heard some really insightful examples of good safeguarding working in Plaistow. So I'm sure we can sort of build upon that with Olympic Park, East Ham South and Canning Town in the room as well as Maryland. So I'd just really like to thank everybody who's sort of contributed to that section. It sort of went on a bit longer than I'd intended, but I think it was a very important conversation and it was good to sort of have an element of depth. And I look forward to picking this up in a later meeting, perhaps when we've got the report or at a later stage. So the committee will now move on to item 9 on the agenda, 0 to 19 health services. This item will explore the current service and its future development. The committee is keen to understand the vision and the structure of this offer, which consists of the council's 0 to 5 health visitor service, but equally the 5 to 19, 25 if there are additional needs, school nurse services. Prior to their 2017 transfer to the local authority, these are services that were previously provided by the NHS in the shape of the East London Foundation Trust. Although they'd previously been sat within the council's youth directorate, otherwise known as Brighter Futures, my understanding is they've now moved over to be part of our Children's Service Directorate, and they're funded, at least in part, with public health grants, and also the service is currently under review. In preparation for this item, I spoke with Sarah Wilson, Director of Children's and Specialist Services at the East London Foundation Trust, to gain a better understanding of the circumstances surrounding the transfer of services from the East London Foundation Trust to the London Borough of Newham. And I also spoke with Kate McGee, Chair of the Newham Association of Nursery and Primary Head Teachers, who kindly provided some feedback from a number of local schools on the current offer. I'll come to this later on. But first, I'd really like to welcome Laura Eden, Director of Children's Services, Victor Cook, Assistant Director for Quality Assurance, and Jonathan Cox from the Public Health team, who I can see online. Is there anyone else who was going to contribute? Because I thought we were receiving the Mayor, but I can't see her online at the moment.
I presumed the Mayor would be here for this scrutiny and for this item, but she isn't and may have been caught up somewhere.
Okay, so it's noted we don't have political representation in the room, so unfortunately that might hamper some of our questions, but it is what it is, and the committee will work with the very capable guests we have. So I'd like to thank Laura Eden and her team for providing the report that's informed this item and the supporting papers, particularly given the pressures of their recent SEND inspection. In the light of this, we'll take the content as read. As the service is formed of two parts, I wanted to start with looking at the 0 to 5 health visiting service and then move on to the school nursing service. So I would welcome some brief opening remarks from Laura and Victor, but given we have no political representation in the room, I'll allow a little bit more time than I would normally do.
Thank you. So, and thanks, I would say, to Adults and Health Scrutiny for scrutinising this area. I don't think Councillor Masters pointed out to me that this area has been to a scrutiny before. It is a children's service because obviously it offers a service to children. However, it's public health funded. So I think it's a really good opportunity for this service to have some scrutiny. We have tried to stick to the key lines of inquiry, but given you haven't had this item here before, I believe we have gone quite wide and covered the organisational structure in the key lines of inquiry, you know, broken down what services do, not just in Newham, but there are some national criteria and national responsibilities that we have to fulfil in providing health visiting and school nursing. Health visiting is going through a reorganisation to bring us in line with the budget and also focus in on the areas that we focus in on our core statutory responsibilities. And so you might want to potentially have some questions around that, whereas the 5 to 19 service and school nursing service is not going through that reorganisation. That has been launched today. So the consultation has been launched with staff today. So the detail of that wasn't included in your report because obviously it would then be public and unfair on staff before the consultation, but it is live, it has gone live today, so we can answer some more intricate questions around that if you have them.
I mean, I think from my point of view, it's trying to understand who these health visitors are. Are they professionals who've been trained within the NHS and that are skilled basically in health services?
Yes, that's right. Yeah, they're all clinically trained.
Because with public health services, when they came over to the local authority, we can see the value that the local authority adds in terms of having access to all the levers around the determinants of health, in terms of community wealth building, in terms of education. What value do you think the local authority has brought to the health visiting service being sat within the local authority?
It's a really interesting question. Nationally, this is a very unusual arrangement, and you'll see in the report that we've covered how this arrangement came to being. Any service that's in the local authority, we naturally would have more control over. However, you can have further direction and control over a very specific service level agreement and specification. I think what's really important to note is the value the local authority add to staff is there are some pros and cons. There are some pros, obviously, of being part of our organisation in terms of our models of practice, our training, being really collaborative with, let's say, our early help professionals. It's much easier for them to say, we're going to use this centre, that's a great idea, let's get involved in family hub work, etc. But actually, for the value added for staff in terms of pay conditions has been really difficult, I would say.
So what's the vision for the service?
In terms of
what are you trying to achieve with it?
Well, it's not only us, it's nationally, isn't it, the vision? The vision is in line with a Healthy Child programme. And so it's interesting, I read your notes, Councillor Masters, thank you for sharing those, about whether schools understand the vision of the service. And I would say over time, I think the vision has got lost in some areas where we've had core responsibilities for health visiting services, but as part of their work, they've got involved in research. We've had to set up RIO systems, which is a health-based system, in with the local authority. So we've had to, we've gone extra. And maybe I'm starting to think that maybe that's why schools don't understand the full vision. But that full vision is laid out in the Healthy Child programme. It's not only our vision, it's a national vision. And we've got to keep to, early language development, pre-conception care, addressing vulnerability factors, emotional health and well-being, and maternal mental health, which includes babies and fathers. So our delivery model for 0 to 19s and 0 to 5s will be no different than what we're nationally required to do.
Jane, I think you had a question around integration with the rest of the service.
Right. I thought, yes, for the health visitors, I beg your pardon, yes. Yes, how do they, the chair's more or less asked it, how does this integrate with other services?
So with the school nurses, see whether there's a connection.
Yeah.
How do health visitors integrate with the school nurses?
Yes.
Yeah, I mean, it's a
and anybody else, but that mainly.
Yeah, it's a single service. So there's a single senior management team. There's kind of agreed priorities that are consistent across the whole service. In terms of working with partners, we work with schools very closely. We're kind of developing our approach with our colleagues across the early health system at the moment, integrating further into the early health, into the family hubs arrangements that we've developed, also children's centres. So in terms of integration across partnership and within the service, it's kind of quite strong. And in terms of we have regular discussions with our school colleagues, so I've seen some of the issues and concerns about communication, and in terms of my leadership, hope to go out to schools and talk about some of their concerns.
And how much leeway do we have within the actual offer? Because I noted you've got the universal offer, you've got the universal plus offer, and then I think there was a third version that catered for people who seem to have more sort of social care related challenges. And it just felt, looking at it, that there should be a bit more leeway to maybe shift some of the visits away from the people who seem to have lower needs towards the people who had higher needs. Is there flexibility to work in that way?
There's some flexibility, but there's also statutory duties in terms of.
That's what I was wondering.
6 week, your 2-year check, your 6 week post check, your antenatal bit. There are some statutory things that we should do for all children.
And there seem to be some concerns that in terms of the visits, one of the impacts of the pandemic was that where in the past that would have definitely been a home visit, now in too many instances it felt like it was a phone call. Is this being addressed?
In terms of the service redesign, that's one of our priorities, to go back to those core mandated checks, ensuring that most of those are done face to face. So that is something that we're ensuring it's consistent right across the service. Hence, we've introduced stronger quality assurance. more checks about quality and the consistency of visits and where they're taking place.
And you seem to have a lot of local teams based in different neighbourhoods. How integrated are they with those neighbourhoods? And does this mean that as a new mother, I would have continuity of arrangements? Because the Commission a couple of years ago did a report on maternity, so we're very aware of the importance of sort of consistency of relationships.
Yeah, so in terms of building that consistency, we've again, as I said, we're quite often co-located with health services. We're looking to use other places where we've got council services. So we're trying to ensure that our service is close to families as possible and that we do offer that continuity. So if a parent comes into a health centre, that they potentially could see a health visitor within that process.
Councillor Keeling.
Do we find any specific outlying issues in comparison to other boroughs in 0 to 19 health?
The major outline,
Yeah, like
that the services in the local authority. I think there's one or two others in the whole country.
Yeah, Jonathan.
I think one.
Because I know you came from Islington, didn't you? So,
Yeah.
So I know that you might have better insight than me on this.
Well, not necessarily. I mean, no, I think what's important is that whether the service is in the council or outside of the council, we've got to make sure that our core statutory duties are done, that we're doing them relationally, that parents and carers can build up a relationship with that health professional, that by the time the child gets to school, if they're in the Universal Partnership Plus or the Universal Plus, they do have a care plan that follows them through to the school where they have health needs, etc. And really focusing on those families who do require that additional support, whilst also fulfilling our statutory duties to everyone across the borough. I think integration into children's centres, into places where families go in our community is key, because actually health visitors, or more health visitors than school nurses, I would say, actually. Health visitors are the ones who would pick up if there are issues around domestic violence very early on in pregnancy. And we know that pregnancy can increase domestic violence, and separation post-pregnancy can increase domestic violence, for example. So we need to rely on those professionals to pick up those issues and avoid children suffering harm. So they're really key professionals to the network. So we have that. We want to do more of it, and it seems from Councillor Masters' feedback we need to do more in terms of work with our partners, particularly our schools, on the vision. There are definitely funding and capacity issues. That's national. We can't, what we can do, we have to do the best with the resource that we've been given. And whilst it is extremely well-intentioned to be part of research programmes that benefit every child in the country, actually, we need to be providing the best service we can to the residents of Newham.
Actually, you just mentioned something there that I wanted to jump in on. You were talking about resources. My understanding is that our 0 to 19 service is comparatively well funded compared to other boroughs. So I'm just interested in why it's overspending. Are there particular challenges that we have in Newham that are influencing this?
I mean, there are particular challenges in Newham. The level of diversity in the borough, which is a benefit and wonderful at the same time, but can mean that extra resources need to be put in terms of basics around interpreters. It may take you longer, the visit, etc. And their particular levels of deprivation mean you're more likely to have early help needs. I think it would be amiss of me not to say that the service has not been operating at its full efficiency. And the reorganisation, restructure ensures that, as well as Victor's leadership in terms of quality assurance and partnership. It's all around what's the quantity and what's the quality. So it is a well-funded service and has been. There's been a reduction in the budget, which has meant we then gone more overspent whilst the reorganisation takes place.
So how is the reorganisation going to improve things?
I mean, a number of different ways. So one thing is about focusing on the core, as we said, you know, so stopping doing certain things like research, for example.
Okay.
The other thing is around reorganising our senior management team.
Okay.
So again, kind of bringing great focus and
right. Volume.
Sorry, could you speak just a teeny bit?
Yeah.
Victor, I couldn't quite catch what you're saying. Sorry.
Just improving the governance within the service, improving the quality, having real clear training plans for staff, learning from when things don't go well. That's something that we need to do more of. The integration, so as I talked about, the family hubs, children's centres, community, having that reorganised. Also, we've got a very experienced health visiting team, and it's about some of the work they could be done by other staff. So we want to increase the skill mix, which would mean sort of developing our own, growing our own staff to sort of supplement service and the very experienced qualified health visitors that we've got, focusing on some very core functions. So we're looking to sort of make some efficiencies in that respect. Also administration, more automation. You've heard in the council, we're looking to do more digitalisation of processes, technology. So ensuring that the health visitors staff have got the tools to do their job. So
in what sense? Can you elaborate? What kind of?
So it's about when so it's about when the staff work remotely, that their tech works. Where if they go into a non-council building, that they can use their technology, they can record on the system. That's why we're introducing or we're implementing the Rio system. Trying to, so basically trying to
integrate them with primary care.
Integrate, be more efficient. So we're looking at a number of different ways, improving the quality, increasing the efficiency, and kind of increasing the skill mix in line with. We've had the independent review done by a peer service, kind of made some suggestions about how we can make some improvements in line with good practice.
Fantastic. Councillor Khan, I've noted, I'm terribly sorry, I just should have called you in earlier, but.
That's fine. Thank you, Chair. I know this is under Children's Services, but we're all under one council. And I just wanted to contribute to the health visiting service and the school nursing contribute a lot toward our safeguarding services, for example, or the child protection process, the conference, full group meetings, as well as, making sure they're part of the discharge from the hospital when a baby's born. So, that is included in part of their responsibility.
And that always happens because I know when I was speaking to Kate McGee, she raised some feedback she'd had from schools that apparently they weren't always being represented in meetings, but that might be a specific point.
And you've heard me say, I mean, you're a governor yourself, Joy's a governor, Jane's a governor. I think that the governing body as a strategic role setter, it's not an operational body, but I always ask, because I'm representing a local authority on 2 primary schools, what's their feedback on the service? Because if we don't get that feedback in terms of the head teacher's report or however the mechanism, I think that's an important check and balance on delivery mechanism, because there's been in the past variability, shall I say, Laura?
Yeah, absolutely. I think what I would say about child protection conferences and core groups is if we had our 4 school nurses in every single child protection conference, they would never be in school.
Yeah.
They would never actually see children.
Yeah.
So where a child's got a health issue, or we're concerned about something like fabricated and induced illness from a parent as a child protection issue, or a child's losing weight or is obese, overweight, then a health professional would definitely need to be at a conference. If the issue is unhealth related, they would need to report to the conference as part of their statutory duty, but I don't think we'd want them sitting at the conference. In terms of health visitors and midwives on pre-birth conferences and under fives, they would always be there because the conference wouldn't be able to go ahead.
Yeah, and in terms of the improvements we're making, part of that is strengthening our safeguarding. So we've got a specialist safeguarding function within the 0 to 19 service, and we're aiming to strengthen that. So they have contact with the MASH. They're involved in terms of the MASH decision making, and also making sure that staff are trained in terms of safeguarding, audits, and just making sure that we've got presence in those meetings. I oversee the Child Protection Conference Service. They're not reported back to me as an issue, but I will, after this meeting, investigate whether there is, talk to the schools about their concerns.
Okay. And moving on to the school nursing services, I mean, I've referenced did you want to come in actually before we?
Yeah, just one major thing that when I saw this report and I was thinking, when I think children and health in this borough, the first thing that comes to mind as an issue is vaccination levels. And I'm just wondering if we have any kind of updates on the work that we are doing to try and increase our vaccination updates. Vaccination rate.
Service, isn't it? I think.
Yeah, that's
a different organisation.
And
It's online.
so Jonathan would.
Jonathan, would you like to update
later on the level?
Yeah, I'm terribly sorry. You probably didn't expect to be asked this in the meeting, but if you've got any, if you have anything to contribute.
We have, yeah, I mean, we have, first thing to say is that the vaccination programme is the responsibility and essentially led by the NHS. Most vaccinations are given to children before they start school. The vaccination coverage is a challenge in North East London. Newham, along with other boroughs, for some of the key targets, is below the 95% recommended for sort of a lot of the key ones. But it's something that is a very high priority in our work programmes, and we work pretty much relentlessly with the NHS. We have a Health Protection Board that looks at how we provide IMS across a whole range, all those children, all those programmes. Specifically in schools, we have NHS England commissions Vaccination UK, which is the school-based provider. They arrange a wide range of vaccinations to school-aged children. So there's things like the HPV program, the IMS, the flu program. They sort of do those routinely and work really closely with schools, and they perform very well. They've been running catch-up clinics and holiday times, for example, so they're kind of really engaged and do work very, very well. We sort of constantly are running wider community immunisation promotion. And as Victor and Laura outlined before, one of the sort of key aspects of the 0 to 5 programme health visitors is checking on IMS status and promoting IMS to families. I think there's an awful lot that takes place. I wouldn't want to kind of go through and list it all, but I'd be sort of very happy to give sort of further information out of this. I know IMS is something that Scrutiny's touched on, I think a few times in the past, but yeah, it's a really big programme of work and a lot of partners, a lot of activity involved.
Thank you.
Yes.
I just want to, there's just one last point on this, and it is, again, it's on the opting out of whether you're vaccinating a child but with this report, I saw very large numbers of people opting out from eye tests and hearing tests, and I just wanted to know some of the reasons why. What would be in those decisions to not allow your kids to get free eye tests, kind of thing?
Well, it's a parental choice. So if it becomes an issue where we're understanding that a child can't see or can't hear, that then becomes a safeguarding issue if you can't convince parents. But it's parental choice, as is, sending your child.
But do we know any of the reasoning why? Or
Not that I know of. we can ask the service to further look into. They probably have more of an idea because they'll ask parents when they're.
It just baffles me, that's all.
Yeah.
Like if I could get my child a free eye test and free hearing test, why not? Why they all getting done all at once?
Yeah, I think sometimes it's kind of understanding and communication.
Yes.
We have a very useful framework, ARCH framework, accessibility, relevance, and trust, and we use those 3 dimensions to try and understand barriers. Sometimes it's trust. You know, obviously accessibility doesn't come up because it's offered in school, but it's, you know, or sometimes it could be relevance. Families just think, well, they can hear and see fine, there's no issue here. So, but yeah, I think the service itself could give further details.
Could it be that, I mean, I don't know what the position is in terms of charges for spectacles, for hearing aids for children, whether there's a fear that there's going to be a cost that parents can't afford. I mean, does anyone know what the current situation is? I mean, we're not children's scrutiny, so I'm not aware in terms of whether or not parents have to pay for their children's sort of hearing aids and spectacles. Anyone?
They don't spectacles, no, unless.
I think it's free. I think it's free.
I think
It's all free, I mean.
It's free, so
That's a charge.
Yeah. Glasses.
So Councillor Novo, I noted your hands up.
that is free. I got it.
Hi, sorry, I think I have 2 things. I think obviously, I think related to what Councillor Keeling just said, I think what I think of immediately is kind of, I guess, mental health. And I guess our safeguarding of children against certain traumas in the home is also mitigatory for any future, I guess, mental health issues that could arise from, I guess, the lack of those safeguards. So I just wondered, I guess, to what extent do you think, for instance, like the school nurses, etc., are equipped in terms of mental health of children, which I think would be, if you would say there is an inadequacy there, if there, I guess, is scope for, I guess, preemptive investment there for children who will eventually become young adults who, I guess, at that age around 18 to 25 will exhibit mental health, and obviously the cost of that to our health and social care system. I guess the second question goes back to an earlier point about the overspend. Obviously, I really, really appreciate the plans in place to increase efficiencies, etc. But I think it was said that, I guess, there were endogenous and exogenous issues as to why there is that increased burden on Newham, as to whether, you know, our diversity and relative deprivation means that there will be an inherent overspend, and also there being some inefficiencies in management that also, I guess, contribute to that overspend. So I wondered if there's any idea of the, what's the word? Sorry, the, like the weighing of those, like, do you know how much the inefficiency is costing relative to, I guess, the exogenous factors like deprivation, etc.? Because obviously, if you make improvements on that, how much do you think this will mitigate the overspend that we see in this area? So I guess those are my 2 questions, and I wondered if anybody would have an idea.
Yeah, so I think in relation to your second point, we have been externally reviewed and we have been advised that we can meet the population's need with the new staffing structure in terms of skill mix, health visiting, clinical health visitors, managers. Now, if there is a sudden rise in population, you know, hopefully never again another pandemic or something like that, of course, we would then need to put in place to meet to meet that increased demand. But actually, the new structure meets that demand. The overspend has been to do with staffing in place where we have to restructure formally to move us to the new model so that we are not overspent. We have been, as Councillor Masters pointed out, well invested in. So the reduction in public health money is acceptable in terms of what is needed for the community. So I'm hopeful with regards to that. I've now forgot, what was the first point? I've now forgotten.
It's about mental health and school.
Mental health, sorry. So I would say school nurses are very well equipped to identify mental health. But it's not only identifying, it's then responding to that. And so once they're very equipped in terms of identifying, as I'm sure you are aware, there is a waiting list for our child and adolescent mental health service. That's a national issue as well as a local issue. We have reduced our waiting time in terms of, for example, autism assessments, which can be aligned with mental health conditions or etc. From 104 weeks to 74 weeks. Let's not celebrate that. Still, families waiting a long time for those types of assessments. There is a waiting list in CAMS which has reduced. So it's what happens for that child and young person whilst waiting, and we call it waiting well. And so it's around school nursing team understanding waiting well. We have an integrated front door, which has been piloted in East Ham, Plaistow. That I heard the other day at board has been really effective in terms of meeting families' needs early whilst they're awaiting mental health diagnosis, for example, but how are we responding to them? And we've got service Newham, which has been doing really well, and all the agencies supporting families and children, accessing those agencies whilst they're waiting, so they are waiting well. But I would say our school nurses are crucial in that and are very well equipped.
So in terms of school nursing, I mean, the feedback I had, and it's quite interesting because when I looked at your new service model, it exactly picked out all the points I'd had made to me, but the service is inconsistent across the borough, that there are real problems with I mean, I think, I went into this not knowing too much about the service. I'd heard on the grapevine that, we got about 8 nurses for the whole borough. And as I understand it, that has always been a problem. And it was a problem when the service was with the NHS. It's a problem now. The idea of each school having its own nurse or even having a named nurse has gone, that they build relationships with a nurse moves on. There seemed general confusion about which services were within the authority and weren't. I mean, you talked about CAMS then. I mean, again, that's, as I understand it, East London Foundation Trust and NHS, it's not local authority. And then the biggest issue that came up was just sort of wait times for health plans. And your new model, which is sort of laid out on page 119 of our agenda, lays out what the model will be. But in practical terms, how will it address the issues raised? And when can our schools expect to see? Because I know that, there'll be various head teachers sort of watching this meeting back. When can they see light at the end of the tunnel?
I mean, I know that the model was reviewed about a year ago. It's now under new leadership. So we're going to review. We've seen the feedback, and I think with the service, there's some feedback about we may not have got it right. So we will look at how we can improve the response.
So you're remodelling the remodelling?
Well, we're
School nursing has not been remodelled.
We're reviewing the response that we put in place a year ago. We're going to do that. We're going to have a look at that, and I'm going to talk to contact Kate to have a discussion about findings for the primary school.
But does it need, and I hate to say this because I also sit on budget working party, but realistically, can you expect to deal with the issues, the scale of the issues being raised across the number of schools we have with the number of staff we have?
There's 2 issues, I think. One is the sort of national issue around school nursing, which Newham faces. The second part is what we can do. So in terms of what resource we have got, we can make improvements in terms of response. the quality of that response and the communication. And we can, improve the timeliness of those plans being created. So those things we can do. What we can't do is increase the resource that we haven't got at the local.
I mean, boroughs used to have, you're talking 40 school nurses, you're talking huge numbers. You look at these numbers, as you point out, there's 8 people in the team. So what I think we need to start with is, what is the expectation? Because some of our head teachers, thankfully, have been around for 25, 30 years. They know what was back in the day, where every school had its school nurse who sat there and saw every child, etc. I think what we've got to is given the numbers and the capacity, what Victor's talking about is what improvements can we make? And also, we need to start with a collaborative approach with schools and making sure that the expectation is clear. I know they realise that those are the good old days when we all used to have a school nurse, but actually what is achievable together in a collaborative approach. What we also need to think about is the prioritisation, and Victor's heads of service has been in communications with a lot of schools where children are awaiting health plans for children with health needs. Now, what hasn't helped is sometimes the inefficiency in the health visiting service, because actually they should have had their health plan aged 3 to 4 years old. Then they're getting to school, and then we've got a even more stripped back resource who are trying to meet that need. So I'm hoping that the throughput will actually improve how many children have health and care plans once they get to school, because actually that would have been sorted out earlier. But our head of service, Portia, is doing a lot of work directly communicating with schools, thinking about how we can prioritise those children where there is real impact. There will always be differences of opinion in what schools feel they need a nurse for, particularly those children with needs, health needs, and what the health service and health plan deems that they need a clinical person and a nurse for, and what the school can do themselves.
I just wanted to bring in, I can see Councillor Keeling wants to come in. I just really quickly want to ask a question, which is, are there any boroughs who are doing this stuff better? Are all boroughs in a similar boat of having a complete lack of team to deal with? And if so, are there any boroughs that are doing a better job of issuing health plans in a more timely fashion?
All boroughs would have issuing plans in a timely fashion isn't something that, as far as I know, Jonathan, is collected nationally.
Yeah.
So we wouldn't know, but we can ask ELF comparatively from our North East London boroughs how we compare. There's not been an issue that we're, bottom of the pile or top of no one's approached us that we're top of the pile. So we'll make the assumption that no is the answer to your question, but I would like to double check that.
Okay.
Jonathan might know the answer.
In terms of health plans, they're not in the way that sort of EHCPs are kind of produced. So that it's not like a statistic that's collected that we could compare on. It's something that we could explore with fellow commissioners. In terms of, I think I'm not so certain about school health nurse, but certainly in terms of sort of health visitor workforce, I think we have been successful, really. Despite there are always challenges in recruitment and retention, but some of the other boroughs around London have much bigger problems with their health visitor workforce. So we have been successful in that, and I think some boroughs are quite surprised that we have retained a lot of health visitors, given the profile of the workforce nationally and the sort of national shortfalls in that workforce. And I think that's similarly probably the case with the school health service. That they sort of a specialist workforce, and it is really quite difficult to train and retain them.
Why is that? Why is there a problem with finding school nurses?
Is there any caring sector the same as teaching?
Is it a pay issue?
A combination of factors.
Yeah, again, because we're sort of in the one council approach that Councillor Khan mentioned. We have been signatories to letters to the ICB about resourcing in terms of education healthcare plans, because it's a joint responsibility of the local authority and Elfton and others, within that system approach. But I think it's important. I've been at a conference all day. One of the things is, there's still not parity of esteem around mental health with physical health, but children's health has been, to some extent, just even more sort of fragmented. And I think there's an important role for us as a campaigning council to make certain that those things about CAMS waiting times, which is a national issue, or EHCPs, or the responsibilities of health with the local authority. Because I think parents and our residents, the children within those homes, deserve a better treatment, but it's a national issue. But I don't think that's an excuse for us as politicians not to carry on the campaigning, because there is a real issue here about capacity, training, wage rates, all sorts of things. Retention, as Jonathan's pointed out.
So we're just having a review at the moment. I ask my question again. When is there going to be a day when schools are going to see an improvement, or is the problem purely one of the resources that are coming down to the local authority, the NHS, in terms of sort of providing services? Can we deliver this service in a better way? And if so, if we were to invite you back to this committee in, realistically, I don't know, say 9 months' time, would you have good news for us? And how much do you think the service can be improved?
We have reviewed the school nursing service recently. And it's, we always need to check on whether our reach is good enough, whether we're intervening early enough, whether we're providing the most effective service. Whenever you review a service, you will always find one thing or maybe 10, but no matter how great the service is, you would always find something if you're going to in-depthly look that you could perhaps do differently, whether that's digitalisation or anything. So, but we are not going to be able to resolve those profound capacity issues. And the change that was put in place years ago around the funding and how much allocation of school nurses that boroughs would get. So my prediction, and you can hold me to this in 9 months, a year's time, my prediction would be, yes, we would review the service and find something that we could do better. But actually, they are probably doing a really good job with the resource that they have. Now, I'm not saying that we have collaborated enough with schools, because it sounds like you've been given really good feedback, and I'd be interested to understand whether we could do anything more in that space in terms of our collaborative approach.
I think the answer to that is definitely just based on the communication I had, that they didn't feel they'd ever had a vision for the service presented to them. Yeah. They weren't sure of what it should be. The relationships weren't continuous. I mean, I have to say, I do find this quite depressing, and I'm not saying this in a mood of blame. I mean, we've just done a report as well, just for context, on the ability of the borough's health and care system to meet the population expansion, and that was depressing too. We're very aware that the whole system at the moment is under-resourced, certainly in terms of the pressures coming down the line. So I guess in that case, all we can do is either have you back, or now that the service is seated in children's services, for you to go to children's scrutiny and present there. But I just hope next time we see you, when we kind of reach out to the schools, we hear, well, actually, Susan, that meeting was quite useful. And since then, we've had a lot more contact from the local authority, and we're a lot happier overall. And we understand what the expectations are, and we found ways of sort of working with the gaps in collaboration with the other parts of the system to make things work better.
Two main points, if I may, from the political point of view. This conference today, there was cross-party agreement that the public health budget should have been increased in line with inflation. The public health budget for this area has been considerable, and that is part of, obviously, we'll have that discussion, obviously, in the run-up to our internal Newham budgeting process. But I just want to reassure people that we are continuing to campaign on the public health budget element of this, but also the service delivery model. And I think that's what, the work that the children's services and adults are doing on the transition issues that we talked about earlier on. The more we can actually keep, and it ties in with what we were saying about safeguarding, the more we can actually keep each other's accountabilities and their resources clear as well on asks of the NHS, for instance, over this service. But it's not just schools who are the customers of this service, it's a wider dimension as well, Sis.
Can I finish on one really contentious question? Because we like...
That's back to law if it's contentious.
I mean, you were saying at the beginning how we're one of the few authorities where these services sit with the local authority and not the NHS. And I was saying earlier about how I totally understand why public health services came over to us, because we've got all the levers to carry out public health strategies. Do you feel that actually these services might sit better within the NHS?
Yes.
There we go.
Quantify that.
Yes, I can. I think hearing from staff, they feel that as well. I think it was never a full intention to in-source or internally have the commission service. There was an issue, as I understand it, it's in the report of the tendering process. And I think not that it's all about the staff, but if staff are well supported, you can attract them, which we have despite the pay. Going back to what Jonathan says, they will provide a more effective and efficient service to our residents, and it is a health service. Now, I say yes, but there are disadvantages and advantages to both sides that will be explored as part of phase 2. Phase 1 is bringing us in line with budget, so that if we were going to go out for tender, we've got a service that operates within budget, and we can have, we can detail that service specification, service level agreement. Is that right, Victor?
Yeah, absolutely. Yeah. So, as Emma said, high quality service, fit for purpose, modernised, and ready to go back to the NHS. And we're going to start those parallel conversations alongside the approvals that we're going to make over this next 12 months.
Okay, so you're saying the time to call you back. If we still have the power to call you back, and you're not summoned by our sister Scrutiny, 12 months time, you're saying would be optimum, maybe. Fantastic. Okay, thank you very much for attending. You're now free to go, although welcome to stay.
Thank you.
So I'd just like to say that the 0 to 19 health services report is noted and will be followed up by us or another scrutiny commissioner at the meeting. So I'd like to thank all the participants and move on to item 10, committee's work plan. Agreed back on July 19th, following an informal priority set by committee members and partners. There have been a number of changes, and asked whether the commission will take the work plan as read, if any changes to events being agreed by the committee informally. You happy with that?
Noted.
Fantastic. Item 11, date of next meeting. We'll next be meeting on the 28th of January. So Merry Christmas, as in committee members, and thank you very much for attending. So I now close this meeting, noting the time, which is 9:15. Thank you very much, everyone.
Thank you.
Thank you. Thanks, Chair.
Thank you.
hit me or is it colder?
It is cold. No, but that's quite nice actually.
Yeah, I'd rather it was cold.